On behalf of the Centers of Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon and I work for Kaufman & Associates. I will be the moderator for today's webinar. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. A Q&A session will take place after the presentation. Above the Q&A pod is the Files pod. You can download a copy of today's presentation slide set by clicking on the file name and then clicking Download in the Files pod. If you need technical assistance during the webinar, please enter your tech support question in the Q&A pod. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You'll receive an answer in the Q&A pod. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With those announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Federal Lifeline Internet and Telephone Discount Program Overview. Our presenters today are Jessica Zufalo, the Senior Advisor for Strategic Partners at Lifeline, Kevin Risser, the Program Analyst for Operations at Lifeline, and Leah Serini, Communications Associate at Lifeline. I will now turn it over to Jessica to provide an introduction to today's topic.
Thank you so much, Julie, and thank you all for being with us on today's webinar. I very much appreciate it on behalf of the Federal Lifeline Program. I'm joined by my two other colleagues, as you saw listed on the slide. I want to say good morning to many of you and good afternoon to many of you. I very much appreciate everybody's participation in today's webinar. We are very excited to have a chance to speak with you all about the Federal Lifeline Program and its terrific benefits to low-income consumers and elders in Indian country across all 56 states and territories. I'm joined here by my two colleagues, Kevin Risser and Leah Serini, who work very closely with me in all of the work we do with our stakeholders nationally and specifically with federal agency partners like CMS as well as the Administration for Children and Families. I have moved the slides to slide number 4, and I want to talk a little bit about who we are because many of you may not know. Then I will discuss some of the program details about what we do here in the Federal Lifeline Program, the application process, as well as the Federal National Verifier, which is a new paradigm that we are required to implement across all 56 states and territories to enhance the eligibility verification experience for all 9 million consumers in this program today. And then we're going to talk about how we want to work in partnership with all of you. Leah and Kevin will also explain how we are doing this and hopefully generate questions and some really terrific, thoughtful discussion as to how we can jointly work together to provide connectivity to our nation's low-income consumers and elders. So I'm going to talk now about who we are at the Federal Universal Service Administrative Company. Essentially, we are a non-for-profit that administers 4 separate programs that are managed. We manage it. The rules are established by the Federal Communications Commission. We administer all these programs that total combined amount to roughly $10 billion in federal subsidies annually nationwide every year. The universal service concept was really born out of really the thrust of Congress to bring universal connectivity, regardless of distance and density across the United States and in Indian country. So the Federal Universal Service Fund is essentially a fund that exists, as the second bullet says on the slide, to ensure that all Americans and all people across this country, as well as Alaska, Hawaii, and the territories, have access to quality and affordable telecommunications connectivity, broadband, voice, video, and do so in a high quality and affordable manner. So we're really thrilled to have a chance to speak with all of you today about who we are at USAC and how we can partner with all of you going forward as we really try to fulfill the mandate that Congress has bestowed on us. USAC has been in existence since the 1990s. The Lifeline program actually started in the 1980s under President Reagan. So it's got a long history to it in being a really important tool in the toolbox of advocates as well as consumers. So on slide 7 is the mission of what we do here at USAC. We administer 4 programs, as I just had mentioned. The 4 programs are the Connect America Fund, which is a about $4.2 billion subsidy that is directed to help our nation's rural, independent, and cooperative telecommunications companies, as well as tribally owned telecom companies, build out broadband in the most remote, rural, high-cost areas of the United States. A very important program. It's the way in which ultimately broadband networks are built in rural America. And then today we're going to talk about the Federal Lifeline program, which is a subsidy that offsets the cost of phone service and internet service for low-income consumers, both in tribal and non-tribal areas. The Rural Healthcare Program is a $500 million subsidy program that is dedicated to support internet connectivity to rural hospitals, rural clinics, as well as skilled nursing facilities to facilitate telehealth and other internet-based healthcare delivery mechanisms. And then finally, the Schools and Libraries Program, which is known as E-Rate, and that program is about $4.2 billion program annually that offsets the cost of internet connectivity for our nation's schools and libraries in all 56 states as well as Native nations. Slide 8 is a bit about our program, which we're really excited again to speak to all of you about, and I'm thrilled that we have such a tremendous participation on the bridge today. The Lifeline program is a monthly discount off of one's broadband or voice or bundled offering. It is really the only program of its kind to offer this level of support for our nation's economically distressed consumers. Roughly 9 million households are in this program today, and of the 9 million consumers who receive the Lifeline discount, roughly 274,000 of them are tribal households. So we wanted to highlight that because we often get asked, well, of the 9 million, how many are Native? And it's sad to see that we don't have as high participation among Native populations and Native consumers as we had liked. So that is why we really wanted to spend some time with all of you today to really give you an overview of how this program works, the contours of what we're doing with the Lifeline National Eligibility Verifier, and how we can do a better job collectively to make sure that more Native consumers are receiving a subsidy that they all qualify for. Eligible consumers who qualify for the subsidy, and I'll explain the eligibility process, receive $9.25 off of their phone or internet or bundled service bill per month. So again, the service can be used for their home internet, for their home phone number, or for their mobile phone. Now, for tribal consumers, those who live on tribal lands receive up to $34.25 per month. So it's a very robust level of subsidy for those living in Native communities. Now I'm going to talk in more detail on slide 10 about the program. just to provide a little bit more of a finer point, the subsidy goes to, again, to reiterate, home phone, home internet, or your mobile phone, or a bundled offering on a smartphone. And we know that a lot of Native consumers that live in very, very remote communities, which is in a lot of cases, have no access to internet whatsoever. There's no connectivity. We totally understand that. So we can talk about that, but this is really an opportunity to help bridge that gap and really help all of you identify where service might even be available in the areas that you interact with Native consumers. On slide 11 is the qualifications to receive the benefit. So all you need to do is, when you apply, is demonstrate eligibility in one of these. So to be eligible for the program, you have to show that you're either eligible to receive Medicaid, SNAP, SSI, Federal Public Housing Assistance, which also includes Indian housing, the Veterans Pension and Survivors Benefit, or you can show that you are eligible based on being at or below 135% of the federal poverty guidelines. On slide 12 is an important slide for, I think, all of you, which is the eligibility criteria specific to those who are living in Native communities and qualify for federal support beyond the list that I just showed you on slide 11. So you can also qualify based on showing that you are getting general assistance support, travel TANF, travel Head Start, or food distribution support. And let me reiterate, you don't have to be eligible for all of them, just one. Either one on slide 12, either one on slide 11 or 12. You don't have to qualify for all, but typically when we're talking about economically distressed customers, they tend to qualify for many of these anyway. But just wanted to make sure folks know that. Now I will talk a bit about the application process and how the program rules work. So the benefit is available to the customer who can document their eligibility. That's very important. And many of you know who work for federal agencies that documentation is extremely important because that is what we are audited against. So when GAO and others in Congress ask how this program is being maintained to the utmost integrity, we must maintain and require the eligibility documentation from the consumers. That's really, the point of credibility in many cases. The benefit is only permitted for per one independent economic household. So that is a unit where costs are ultimately shared in a home, and we can drill down into that a bit further. However, I will tell you that if you live in a nursing home, or you live in a homeless shelter, or you live in a situation with roommates, those are the exceptions because you're not sharing household expenses, if you will. So, or you're living, or you're in a VA medical facility. You definitely can be multiple Lifeline beneficiaries under one roof. And a very important piece is that the customer must recertify that they are eligible every year. It's really important. I want to stress that. I want people to really circle that if you've printed out these slides, because what we're learning is that there's so many consumers in Indian country that are eligible and then they forget to recertify and we lose them. We don't want to see that anymore. So I'd love to, at the Q&A session, talk about how we can work together on that. The application process is as follows on slide 15, is that the customer must gather their eligibility documents. So a letter from any of the benefit programs that I listed on slide 11 or 12 that document that they're eligible for one of them is very, very important. Then the customer can then choose who their provider is if they either go online at their library or at their home, or can look up that we have a tool called Companies Near Me where they can type in, I I live here or I live somewhere, and they can see who is serving them. They can also call our customer service center, which is a 1-800 number, and we know, again, that numerous consumers do not have internet access. So that's why we have a customer support number available for all of them. And then the telephone provider in that area will then help the customer through the application process. So then, to receive the benefit, the phone company that is selected will tell the customer that they're either, that all their documents were cleared and they're eligible and they're now enrolled. And then the customer will then begin to receive the discount off the phone bill on a monthly basis. So all told, that takes, that could move super quick, like within a week, maybe a couple of days. Doesn't even have to be that long. And that's our goal, is to make it as quick and painless as possible. On slide 16 is the company's Near-Me tool. So if you put in the zip code, or you just say, I'm at a certain location, like I live at Window Rock, or I live, Colville, or I live, somewhere in Bethel or something, you can put it right there, and then you press search, and it'll show you the providers in that area. And so this is on slide 17 is an example where we put in the zip code of the area where the Mississippi Choctaw is located, and we sure enough found the phone numbers for the providers in that area, kind of service they're offering, where they are, so the customer can call them and say, hey, I want Lifeline. I want Lifeline subsidies off my bill, and I want to talk to you about that. Slide 18. My colleague Kevin is an expert in the recertification space, and I'll turn it over to him.
Okay. Thanks. We referenced the National Verifier a few times in this presentation, but we want to talk about this new project that USAC and the Lifeline program are in the process of. I'm referencing a different deck. Looking at slide 18, the annual recertification process. So to maintain the Lifeline benefit, consumers must recertify their eligibility each year. So the phone company or USAC will send reminders to consumers about the upcoming recertification window, and this is to ensure that consumers can maintain their eligibility for the Lifeline benefit. It's very important to call out here that if consumers do not recertify their enrollment status, they will lose their benefit. And this is something we really want to stress, that this is an annual process that subscribers can expect to go through every single year. It's very, very simple to complete, but if it is not completed on time, they will be de-enrolled from the program. So any assistance that can be that we can receive from service providers or community members to ensure that the information that consumers are receiving about their Lifeline benefit, they're acting on it, will enable more consumers that are eligible for this benefit to retain that benefit year over year.
Yeah, this is very important, folks. Slide 18 is very, very important. So we just want to make sure that you print it out, because we're running into some interesting challenges out there and getting people recertified because they're just not doing it. And it's for a variety of reasons. It's a very displaced population. Sometimes things are difficult to keep track of this customer base. And I think many of the people on the phone would agree with me, given your nexus to Medicaid and other federal benefits. So moving to slide 20, we're going to talk now about the Lifeline National Eligibility Verifier. So let me give you a little bit of background on this. So because we run this program of 9 million Lifeline low-income consumers, traditionally, since the program's inception, the industry, the phone companies, were responsible for verifying the eligibility of these consumers. And because the Federal Communications Commission oversees the rules, and we are the back office administrator, they determined in 2016 that the eligibility verification responsibility would be shifting from the industry, away from the industry, and would be bestowed on us here at USAC. Because we are a neutral third-party, entity whose fiduciary responsibility is entirely focused on the consumer and program integrity, We are now in the process of coming up with systems and new ways of business, new business processes to verify the eligibility of 9 million people. So that's where we also wanted to bring this to your attention as well, because it's a huge, massive mandate, and we are struggling but also succeeding and learning how to do things differently, and being extraordinarily consumer-facing in our work, but also agency-facing as well. So the National Verifier essentially is nothing more than a platform to determine the customer's eligibility in a real-time fashion, and also conduct the annual recertification, as Kevin just said. So as a result of that, Kevin, Leah, myself, and the whole team here are partnering closely with our state human service agencies, federal agencies like CMS, BIA, ACF, and others that intersect with these programs and these consumers as well as tribal agencies, those who administer tribal TANF, Tribal Head Start, and other tribal-based public assistance programs. Our goal is to leverage existing eligibility data sources, because I have no way of verifying the eligibility of the consumer without checking a credible data source. So, for example, we are working closely with the Data and Systems Group within CMS to somehow figure out a way to query that data source to determine whether Jessica Zuflo, if I apply for Lifeline support, that then the people here, my team here, sends a query as to whether or not I am indeed getting Medicaid. And the query is essentially coming back a yes/no basis. So USAC already has substantial levels of PII. We already have substantial PII on all 9 million consumers, including tribal consumers. We have their first name, last name, date of birth, the last 4 digits of their social security number, and or their tribal identification number. We have their address. So we have a substantial amount of data. What I don't have is whether or not they're receiving SNAP, Medicaid, federal public housing, tribal TANF. I have no window into that whatsoever. Historically, the phone companies did that. Now we have to do that. So want to make sure you're aware of that. On slide 21, you can apply in 2 ways, and we know that, again, being cognizant and sensitive to the fact that a lot of Native consumers have no internet access whatsoever, they can mail in their applications to the Lifeline Support Center. The address is on the left-hand side of the page. If they want to upload it at their library or at their home, they can also visit the consumer portal, go to checklifeline.org and create an account. They can do it at the Human Services Agency office as well if they don't have internet. And so those are the main ways of doing that. And then we will contact the customer by email or by mail as well. On slide 22 is addressing. So I'm going to turn it over to Kevin, and he will talk a little bit about our addressing format.
Consumers have several options to show USAC where they live if the address cannot be automatically validated. In the National Verifier web portal, a consumer can drop a PIN on a map that is available in the interface, or they can also type in their latitude and longitude coordinates. And these features have been added to ensure that consumers who may not be able to have their address completely validated by our system are still able to indicate to us where they physically reside.
Slide 23.
Consumers can also mail in images to USAC to show their address, which include options such as a hand-drawn document that identifies the consumer's home address by identifying the nearest crossroads or mile markers, identifiable landmarks, and even distance between the locations. They can also send in a printed satellite image from a mapping tool like Google Maps with a pin identifying the consumer's residence and the latitude and longitude coordinates, and our support agents can use that information to apply it to their application. Here we have a list of some of the documentation that consumers can mail in to USAC to show their address. You'll see that we try to provide as many options as possible to the consumers so that they have there's a variety of ways in which they can confirm to us what their address is.
Right. So this is a list of all the ways in which the customer can prove their address to the Lifeline program. Again, this is a federal requirement. So if the folks on the bridge have any ideas as to how we can do this more intuitively, a little bit more sensitively, we would love to get your thoughts. We're trying very hard to figure out ways to help Native consumers who may not even have, in most cases, don't have a physical mailing address. So we're very aware of that in our discussions with Native nations. Here on slide 25 is an overview of the Lifeline National Verifier and where we have launched the Verifier. So the states, on the top of the page, we have conducted hard launch, which means that phone companies in those states are required to use the Verifier system. They are required to do so, and to basically check the customer's eligibility. And the web interface that you're looking at on the right-hand side of the page is what comes up for the consumer, for the customer to determine whether or not their state is in the National Verifier or not. And we have soft launched in the states that are listed at the bottom half of the page, which means that it's an optional function for phone companies. What that means by optional is that they are not required, but we strongly encourage them to go into the system, try it, check it out, give us some feedback, let us know what they think about it, and iterate and see if it's working and if there's any challenges that we need to be addressing in terms of their usability of our verification system. We are launching, the FCC has required us to basically check eligibility for all consumers in all 56 states and territories and tribal nations by the end of this year. So it's a very big undertaking, and we're doing everything we can to do it in a sensitive, thoughtful way. The benefits of the Verifier are the following on slide 26, is that the customer can find out very fast whether they are eligible or not. It's just, like within minutes. That really helps the displaced customer stay engaged, stay focused, feel that they are being serviced in a respectful way. It also lowers the administrative costs of just this program and really helps, we think, manage and reduce the consumer phone bill that fund all 4 USF programs. The Federal Universal Service Fund is funded through end user surcharges. So when you see the Universal Service Connectivity charge on your phone bill, that is collected by us. It is mandated by the FCC. We collect it and then we distribute it into programs like this. So it's not just going into the sky. It's actually being used in a very, very important way. The real-time checks that we do on the eligibility information really helps us improve the data and improve ultimately the integrity of this program so that we can keep this program going in perpetuity. We currently, as I said earlier, are pursuing a lot of federal data connections. Like we have one with the Department of Housing and Urban Development where we check all federal housing, public and any housing clients to determine their eligibility. We are in the process of developing and finalizing a data agreement with CMS, and we're really trying to get one with BIA. It's been a challenge, but I welcome anyone's help with that. We've had some very difficult times trying to get through to BIA to talk to them about the all-around, benefit, if you will, to BIA and to its customers. We can figure out a way to get them this benefit faster. And the way to do that is to ultimately connect to the general assistance database. with next steps, I'm going to turn it over to my colleague, Leah.
So USAC is working closely with the remaining states, territories, and federal and tribal partners to bring more states and communities into the National Verifier in 2019. And something that I did want to mention is that we also recently launched in Indiana, Kentucky, and Michigan. So we just recently had another launch in March, and we look forward to bringing the rest of the states and territories in by the end of 2019. USAC is continuing discussions with relevant federal partners to automate the verification process for consumers. So we are working to connect more databases to ensure that consumers have a quick eligibility decision and are able to receive that decision as quickly as possible so that they can start receiving the Lifeline benefit. And USAC will continue to establish connections to available data sources where it is cost effective, again, to ensure that our consumers are able to receive the benefit as easily as possible, and so that it's as accessible for them. So we are continuing to partner with tribal communities to identify where these opportunities to train tribal agency caseworkers and other social service personnel to help tribal communities access the Lifeline benefit. We really want to help social service agencies and caseworkers that work with tribal communities act as a community that can help their clients enroll in the program and apply for the benefit. So we also want to work with agency caseworkers and social service personnel to create a simplified application experience so consumers can sign up for federal benefit programs and Lifeline support simultaneously. We know that the application process can be burdensome for consumers, especially when they are trying to apply for multiple federal programs. So we really want to work with the other federal programs that can act as an qualifier for the Lifeline program to ensure that they have a simplified enrollment process and to ensure that they are again able to access the program in a quick and easy way. And so we do welcome your ideas on how to coordinate our application process to ensure that it is a simplified process and to ensure that consumers are able to apply for the benefit quickly. We are eager to hear your feedback on what works and what doesn't work, and we would love to continue these conversations with you. So here are some examples of how we can work more closely with your communities. And again, these are some ways that we have worked with tribal communities in the past, and we are open to hear what other suggestions that you may have. So some examples of how we've worked with tribal communities is attend powwows, community meetings, annual fairs, workshops, and other outreach events to increase awareness for the Lifeline benefit. We also, again, would like to arrange discussions with tribes' human service agency directors and caseworkers. And lastly, schedule regular in-person targeted trainings and workshops like this one about the program and about how you can apply and how you can help your consumers apply.
So I want to just some follow-up items. So as Leah said, we really want you to introduce us to your human service agency directors, caseworkers. It's very important for us. We're really trying to intersect with these folks because we think that they are the best touch points. They are working with the client as the closest than anybody. So to the extent we can help them benefit, learn about the benefits program, train them with just some basics. So that means that Leah, Kevin, and I are really thrilled to spend some time out anywhere in the field. In fact, Leah is speaking to a number of native telephone providers at the Mescalero reservation in a couple of weeks about the federal Lifeline program. So we're really thrilled to have a chance to get out there and help those who directly interface with the clients. And then help us understand some of these challenges that all of you are dealing with as federal program administrators and people that administer federal benefits, but also people that interface with the clients as well. We know that internet connectivity, phone connectivity is really hard, it's costly, and so we want to come up with ways to learn from you on how we can do a better job and really just help us increase the awareness about this program because As you saw in the beginning of the slide presentation, we have less than 274,000 people out of 9 million who are native receiving this benefit. So let us help guide us in how we can boost those numbers. So on slide 32 is our contact information, and we just are so thrilled for the opportunity to spend this afternoon and this morning with many of you. And at this point, I can open it up for questions. So on behalf of my colleagues here at USAC, we are just absolutely honored and thrilled to have a chance to talk to you guys about this program.
Great. So we'll go ahead and take this time to shift over into our Q&A session. So we have had a number of questions come through the Q&A pod, and so we'll go ahead and address those now. So to start, the first question that came in was about where can Spanish language community materials be found?
Leah will answer that.
So we have Spanish material on our website. On the Lifeline support website, we have some Spanish material for consumers and for service providers. We have a brochure in Spanish and a few other items. And then also the consumer portal has the ability to be translated into Spanish. So when you get to the consumer portal, you have the option to go through it in Spanish or English.
And I do want to follow up, this is Kevin, I would like to follow up that any outreach that we send to a consumer will be sent in both English and Spanish. And that includes any forms that we send both an English and a Spanish version of that form. And any robo reminders that we send to them are also sent in English and Spanish.
Thank you. Next question.
Great. So the next one, this question came up during Jessica and Kevin's segment. Can multiple residents at a tribal nursing home receive this benefit?
Yeah, that's a great question. In this case, yes, multiple residents at a tribal nursing home can receive this benefit. These are individuals that are living at the same address, but they are not sharing expenses. They're not the same economic household. So in this case, yes, individuals at a tribal nursing home can receive this benefit.
Okay, and the next question is tied closely to that one, and it is, are nursing home residents eligible if they already have and pay for a personal smartphone?
Yeah, that's a great question. So the answer to that is yes, and I do want to clarify that if you're currently receiving service from a phone provider, that doesn't impact whether or not you can still apply for the Lifeline benefit. You would just need to confirm whether or not your service, whether your telephone provider offers the Lifeline benefit. And so yes, but nursing home residents are eligible if they already have and pay for a personal smartphone.
Okay, great. The next question came up during one of Leah's segments. Is yearly eligibility based on a calendar year?
So yearly eligibility, which I think that is in reference to the recertification process, is based on when the consumer receives an eligibility decision from either USAC or the National Verifier. So it's not based on a calendar year, rather when they are successfully enrolled in the Lifeline program.
These are great questions. Keep it going.
The next question is, where is Arizona in the verification process?
Hi, this is Jessica. We are working really, really hard to get Arizona into the Lifeline National Verifier. I would say in the next quarter. I think we started second quarter. So I would say maybe third quarter, end of third quarter. Don't quote me on that, but we're working actively with the Arizona Department of Social Services to leverage their SNAP and Medicaid database to verify the eligibility of all Arizona Lifeline subscribers. However, if you have any, let me turn this back to the audience. I need help. I need help connecting to tribal databases. I've had a very, very difficult time because, I really need need to verify the eligibility of Native consumers, and some Native communities and Native nations have databases that include the information on eligibility for tribal TANF consumers. So, for example, we have in the past tried to coordinate with the Department of Self-Reliance on Navajo, and they have a tribal TANF database. But because of the change in leadership at Navajo, we don't know who to talk to. I don't have relationships there because we don't know who to speak with. So if you can help me connect with the right people who are at the Department of Self-Reliance, we would be able to verify the eligibility of every single Navajo consumer in Arizona and New Mexico if we were able to connect to that database somehow and verify everybody. So I'll just put that out there for those who have asked.
Okay. The next question is, in Alaska, they do not have tribal reservations. Do tribal citizens receive the 3425 benefit?
Absolutely. Absolutely. In fact, my understanding is the entire state of Alaska is deemed Native. So as a result, everyone in the state of Alaska is eligible for the 3425 based on providing the eligibility documentation. Yes.
Okay. Is there an age requirement for eligibility?
Yeah, that's a great question. Consumers under the age of 18 can, so there's no age limit, but consumers under the age of 18, in order to demonstrate eligibility for the Lifeline benefit, would need to show proof of emancipated minor status. So individuals under the age of 18 can receive this benefit. Again, they would just need to show proof of emancipated minor status.
But in terms of an age limit, no. Like, you can be as old as you want.
Okay. The next question, if for just reaffirming, is this benefit only available for Native residents residing on reservations?
No. The benefit is the $9.25 is for those who are not Native and do not live on Indian federally recognized tribal land. So for those who are non-Native, it's $9.25. For those who are Native and live on federally recognized tribal land, who qualify based on the criteria I showed you guys on slide 11 and 12, they are eligible for $34.25 off of their monthly phone and or internet bill.
And just for clarification, so if a Native residing in an urban area, they would only be eligible for the $9.25 per month?
That's correct. That's correct. That's how the rules are. I hate to say that, but that is those are the rules set forth by the Federal Communications Commission. So that's how they've established that rule.
Okay. The next question is, can we become certified to help qualify our clients with this benefit?
That's a great question. At this time, we do not have a certification process to assist consumers with enrolling in the Lifeline benefit. Right now, the stakeholders in this process that conduct that are the the telephone providers. But we would love to get your support in making consumers more aware of this benefit, and the individuals and the community members that you work with aware that there are people in their communities who may qualify for this benefit. So there's no formal certification process at this time, but we would love for you to be able to help us get the word out about this benefit in your community.
Right. So all of you are validators. All of you are community-based connectors, and we need your help in carrying out the message, as Kevin said. So there's no certification, right? You don't need it. We just need you to learn, participate in webinars like this, and share information with us. Please give us your contact information, and vice versa, so we can just stay in touch and help jointly these clients.
Okay, and the next question is, how often is the information under the companies for me updated?
So we update that pretty regularly. We just have service providers let us know what areas they do and do not cover, and then we update it as often as possible when we get that information from them.
And the next question is, how can this information be shared during within a Native community through a health fair? Is there a communication packet available that folks can request?
Yeah, sure. Absolutely. We'll get you with anything you need. We will properly and, really try to make sure that you get everything you need for health fairs. Leah handles all of our communications, all of our documents, all of our brochures. If you need talking points, I'm sure we'll get you anything you need. You just tell us.
Okay, the next question is the $9.25 the maximum discount no matter the carrier, unrelated to tribal lands?
Yes. So yes, disregarding the tribal benefit, which is more, which is $34.25. The Lifeline discount is $9.25. So that is the standard discount that is applied to all subscribers in all 50 states and 6 territories. But again, we do have the tribal benefit, which is $34.25.
Right, and those are levels that are set by the Federal Communications Commission. We don't have control over that. We just administer it. But it's always a source of criticism of the kind of support being made available. Social service benefits are sometimes not always popular among some, and so it is the level that's been set by the FCC. If there are stakeholders that have views on that, we encourage you to share that with the FCC.
Okay. Another question is, if a consumer is delayed in getting approval from a telephone provider for several months, can the assistance be back credited or refunded?
That's a great question. Unfortunately, the assistance is going to be applied to the actual telephone bill. So that refund would be something that would be administered by the service provider in question. However, I will say, though, that if you have a consumer, or if there's a consumer that is concerned about not getting a response from a service provider or a telephone provider while they're trying to enroll in the program, please reach out to the Lifeline Support Center, and we can assist in resolving that issue for them to ensure that they are getting that benefit after they have been deemed eligible.
Right. So again, if the provider is not providing the service or being responsive to the customer, let us know.
Okay. Another question is, are there any special provisions in the application process for survivors of domestic violence?
That's a great question, and I think this is being asked in the context of certain privacy or identity considerations. And this is a scenario that I myself have assisted with before. If this is a situation that does come up for one of your constituents, please reach out to the Lifeline Support Center, and we can accommodate these specific needs of an applicant. So this is something that we can accommodate through the Lifeline Support Center.
Okay, great. Can you discuss assistance differences between the primary territory telephone provider compared to the lesser assistance available through other providers in the area?
I don't quite understand the question. So what I will say is that if a phone company is in a service area and they are not providing Lifeline services, please let us know. Typically what happens is the phone company must enroll or apply, if you will, to participate in this program. But any service provider that's in your area, chances are they are providing a lifeline. They're participating in this program. So if that is not happening for any of your clients, let us know.
Okay, the next question is, do applicants require proof of income or just program eligibility, i.e. proof they are already receiving SNAP?
Yes, so either, right? You don't have, as I said on slide 11 and 12, you just have to show, demonstrate eligibility either through income eligibility threshold, as I have explained, at 135% of the federal poverty guidelines, or any of the eligibility programs I showed you, SNAP, Medicaid, SSI, not all of them. You could just, all you have to do is show us that you're eligible in one of them.
Okay, and the next question is a little bit similar. Can a parent who has a child on Medicaid be eligible for the Lifeline service?
That's a great question. And yes, this is what we consider to be a benefit qualifying person. And in this case, that parent who has a child on Medicaid would be eligible for the Lifeline service. So the answer to this question is yes.
Okay, the next question is, are Washington and Texas working on adopting the national verifier? If so, with which agencies?
Sure. We're working with agencies in both states, and they're both a little different. And I don't want to go into too much detail for everybody on this call, and I'm happy to kind of walk you through those details if you reach out to me. Washington State, it's the Washington Department of, I think, Social Services. I don't remember the name of the exact agency, but it's the agency that administers SNAP and Medicaid. In Texas, it's a little different because in Texas, the Texas Public Utilities Commission manages the process exclusively. And we just had some very recent discussions with them in Austin about, my boss actually flew there and spent a whole week last week in Austin just talking to them about the national verifier. So I'm happy to give you those details offline.
Okay, great. The next question is, are the individuals informed about needing to recertify?
That's a great question. When a consumer is required to recertify their Lifeline benefit, they are outreached by USAC or their service provider in the mail, and they are sent a letter notifying them that they do need to recertify their eligibility and that they have a specific time frame, and that time frame is indicated to them into what is mailed to the consumer. USAC, through the recertification process that it administers, also sends robocall reminders to consumers to remind them of their benefits. So yes, there's multiple points of outreach to consumers when they are required to recertify.
Okay, great. The next question is, can you receive assistance with cell phone and home internet at the same time?
I'm sorry, can you say that one more time?
Can you receive assistance with cell phone and home internet at the same time?
No, you cannot. You either select home internet or you either select, fixed or mobile. You can't have the subsidy apply to both forms of communication that you're receiving. So mobile could be mobile, your mobile device, your mobile phone that is both potentially smartphone and receiving voice and text and so forth, or your home internet, or your home voice. But you can't have a subsidy on all three. I hope that makes sense. It's a little confusing for those who may not be in the telecom industry, but you can have internet and voice on your mobile device. You can also have your home internet, but you can't have it on multiple modalities.
Okay, and the next question is, what do you mean when you refer to tribal databases?
Sure, I think that's an outstanding question. So, like state human services agencies that oversee the distribution and management of SNAP and TANF and Medicaid, tribal governments also, not many, but some, have databases themselves that include the eligibility information of all of the clients that live in any country in their native community, for those that receive tribal TANF, tribal Head Start, etc. So when I'm referring to a tribal database, what I mean is going to a native nation and working with their human services agency to develop a computer matching agreement to get that native nation into the national verifier. That's what I'm trying to accomplish.
Okay. So we have time for just one last question, and then we'll take closing remarks.
Okay.
And the next question is, do you have any influence with companies like AT&T to bring Lifeline benefits back if they have canceled it in a specific region?
We have no influence over the industry whatsoever. And I will say a couple of things about the dynamics. This is a program that serves low-income consumers, so it's very difficult sometimes to really rally the industry to meet the challenge and provide service at a discount. These are consumers that are not considered profitable. You know, if you're a corporation, right, or an entity that's seeking to deliver and generate returns. So we oversee the distribution of the benefit, and we manage all the programs, operational elements of this program. So the only level of influence we have is that if a company seeks to provide the benefit, you know, we have a relationship with them, so we try to, you know, oversee their practices. But we are not a regulatory body, so we don't have any, we have no recourse other than to stay on top of the provider to say, hey, what are you doing? But that's if they're providing the benefit. Now, not all carriers are providing the benefit. Certainly not. Most cable operators are not, and there's a number of other entities that are not. So the FCC has the oversight function that they can execute if this is brought to if any concerns are brought to their attention with respect to a specific phone company.
Okay, so those are all the questions that we'll take today. Jessica, before we close out, are there any other last remarks you'd like to make?
Sure, I just want to thank everybody, and I really encourage you to reach out to Leah, Kevin, and myself for the questions or concerns. We've received quite a bit of really good questions on today's webinar. We're always available to have more targeted webinars for your agencies, your offices, in your respective regions. This is just a high-level overview, but very, very important for all of you to know about this program because it's not fully being utilized in a lot of areas, and it's out there. And we'll do everything possible to partner with you to bring connectivity to Native communities.
Excellent. Thank you. I'd like to thank Jessica, Kevin, and Leah for joining us today and sharing information about the Lifeline Benefits Program. In closing, I'd like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov on the Tribal LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.